Good morning, good afternoon, good evening. We are so happy that you're joining us for this Data for Nutrition webinar to hear insights into the background and development process of the health sector recommendations in Nigeria, data coordination challenges facing the health sector, and how the health sector recommendations will help address the identified challenges, and how development partners can align their data to national nutrition data platforms. Microphones and videos are disabled during the presentations. Use the chat box at the bottom of your screen to chat with other participants or to contact our Data for Nutrition for support. We encourage you to share your questions with the speakers using the Q&A function. So not the chat, but the Q&A function outlined in blue on the screen. We will answer as many questions as possible during the Q&A sessions. If possible, please include the name of the speaker to whom you are addressing your question to. Answers to all of the questions and copies of presentations will be shared on the community's event page in the week after the webinar. A recording of today's webinar will be immediately available on the Data for Nutrition YouTube channel. Today's webinar is hosted by Data for Nutrition Community of Practice. Data for Nutrition provides members with opportunities to share knowledge, experience, and questions relevant to strengthening the nutrition data value chain at all levels for the purpose of achieving better nutrition outcomes in low to middle income countries. If you're interested in sponsoring a future webinar, we'd love to hear from you. Distinguished participants, I'd like to welcome Ms. Ladidi Bako Ayugbusi as our moderator. A public health communications specialist and a career civil servant with over 30 years of experience in the public sector. She's the director of the nutrition department at the Federal Ministry of Health and Social Welfare. Since her assumption as the head of the nutrition division in August of 2023, Ladidi has been championing initiatives to strengthen organizational and national structures towards repositioning health sector nutrition programming in Nigeria. Some of the quick wins already recorded include elevating the nutrition division to a new department, improved team cohesion within the new department, and increased budget lines for nutrition activities in the ministry. Ladidi completed the Senior Executive Course 44, 2022 of the National Institute for Policy and Strategic Studies, and was conferred with the award of Member National Institute. A very warm welcome. Thank you.
Distinguished participants, good morning, good afternoon, good evening. On behalf of the Coordinating Honorable Minister, Federal Ministry of Health and Social Welfare, Nigeria, the Data for Nutrition, I will like to join the Data for Decision in Nutrition to welcome you to today's webinar titled, How Do We Improve Nutrition Data Coordination, Learning from Nigeria's Health Sector? The focus of the webinar is to share the experience of developing recommendations for coordinating nutrition data collected nationally in Nigeria. We have a speaker and two panelists who will share their knowledge of this process. Thereafter, we will take some questions from the audience, which our speakers will respond to. Please kindly type in your questions using the Q&A box. Distinguished participants, I would like to introduce our first speaker for today. Olufolakemi Mensi Anjorin is a public health nutrition consultant with 16 years of experience. She holds a PhD in public health from Walter University, USA. She is the Data for Decisions in Nigeria in nutrition focal points in Nigeria. Olufolakemi leads nutrition, agriculture, and health initiative, a non-government organization based in Nigeria. called NAHI for short. The first panelist is pharmacist Beatrice Orume, who has over 25 years of experience in healthcare delivery. She is presently the head of Nutrition Information System Division of the Nutrition Department of the Federal Ministry of Health and Social Welfare, Nigeria. The second panelist, Mr. Edward Utondo, is a public health professional in health and nutrition information systems, monitoring and evaluation with over 15 years of experience. He has field and management experience in population level surveys, which includes SMART, DHS, mixed food consumption and micronutrient surveys. He also has experience in routine health and nutrition data and program evaluations. Edward is an information management officer, data analyst, and evidence with UNICEF Nigeria. I will now invite Dr. Anjorin, who for the next 10 minutes will present the background and development process of the health sector recommendations, highlighting an overview of the recommendation. Please welcome Olufolakemi. Thank you.
Begin. Okay, thank you very much. It's my privilege to present the topic as introduced by the Director of Nutrition, the Department of Nutrition in Nigeria. I'll be speaking on the background and development process of health sector recommendation for nutrition indicators collected nationally in Nigeria. This document was launched in September 2022. Next. And just to provide a background to why do we even need the document and why are we talking about data or indicators for nutrition in Nigeria. Data are the foundation for a functional nutrition information system. And we often need relevant, accurate, complete, and timely data to be able to understand the nature, the causes, and the scale of nutrition problems. And also we need data to design effective nutrition policies and programs, and also to establish targets and evaluate progress against these targets. The challenge, however, is that nutrition stakeholders in Nigeria face a lot of challenges in ensuring the data that are needed to develop effective nutrition information system is available. Next. So one of the coordination challenges is that data come from multiple sources, which are managed by different actors, both within and across sectors. So for instance, in Nigeria, you have up to 14 ministries, departments, and agencies that are implementing nutrition in Nigeria. And we have a lot of surveys, periodic, administrative, data sources that contributes to this. So the data users, even the producers, they're often faced with multiple data sources and challenged with how to use them. So next. So if you take an example of the National Demographic and Health Surveys, this is a survey that is conducted every 5 years, but often have many stakeholders involved, and the data, the questionnaire is often updated at the global level. So there is really limited opportunity to add indicators at the national level. Next. We also have the example of the recently completed food consumption and micronutrient survey in Nigeria. So even though this is primarily coordinated by nutrition stakeholders in terms of the planning, data collection, however, it's really very expensive to conduct. And the last time we had this type of survey was in 2001 in Nigeria, which is over 20 years ago. So we don't want to wait for 20 years to be able to make decisions on what affects the population of Nigeria, or even any context for that matter. Next slide. So we also have issues of the indicators that eventually gets to this myriad of data sources, like we've mentioned NDHS, we have the multiple indicator cluster surveys, we have the smart surveys. So these surveys, the indicators that often get there depends on who is at the table at the planning stage. So if an indicator is relevant and you don't have the relevant actors at the table, it may not be featured in discussion on data collection. Next. So also, there are issues of cost challenges. So we mentioned the food consumption and micronutrient survey. So in terms of budgetary estimate, it took over $16 million to get this survey done, and over an extended period of over 2 to 3 years. So considering all of these issues in data collection, it needs dedicated planning to be able to ensure that we are collecting data that are required and that are meaningful to be used. Next. Okay, next slide, please. So in terms of this, this is why this recommendation is very important, because it helps to identify priorities for nutrition data collected at national scales. It helps to be able to make practical suggestions for inclusion of priority indicators in surveys and administrative system, which I will talk as I advance, and also present consideration for putting these recommendations into practice. So like in the recommendations, there are recommendations on how to use the document, right? So next. So how did we then get to the development of this? So there are 3 phases or stages, as it were, that were taken to be able to develop this document. So the first stage was the preparatory work. The second is the development and review of the recommendation, which I will also talk more about as I proceed. And the third stage is the dissemination and uptake of the document. So in terms of preparation, this started up about mid-2020 during COVID, where we started to conduct DEX reviews to look at what are the monitoring and evaluation consideration in some of the national nutrition relevant documents. Subsequently, there were stakeholders interviews conducted between March and September 2021. Then the findings were analyzed, and presented for validation. And of course, there were costing consideration. Next slide, please. So in terms of this preparatory stage still, we did policy content and M&E framework. We mapped availability of data, and we looked at over 17 documents to map the different indicators they considered. We talked with over 70 data users. We also engaged with partners that are supporting nutrition activities in Nigeria, for instance, Save the Children, the World Bank, Accelerating Nutrition Results in Nigeria project, the World Food Program, to review some of their nutrition indicators they collect for their programs, and these were then subjected to review by National Nutrition Task Team. Next, please. So in terms of the tax team, this was led and convened by the Federal Ministry of Health and Social Welfare, where there were dedicated teams from across ministry departments and agencies in Nigeria, and also development partners supporting nutrition, that were put together to continue in a iterative way to look at the outcome of the formative research conducted by DataDen team. And also, there were about 5 meetings, both virtual and in-person, conducted to be able to achieve this. And you can see we have lists from, for instance, the National Bureau of Statistics, which is like the data custodian for surveys and in Nigeria, when you want to talk about representative surveys and all of that. So we also have partners, we have donors, constituting almost about 15 members. Next slide. So in terms of the review, also there were over 50 nutrition actors from federal and state levels because we conducted data collection in both Kaduna State and Lagos State. And so we have stakeholders from these states also validating some of the findings to see whether the assumptions by the teams are correct. They were, of course, reviewed by senior Federal Ministry of Health and Social Welfare leadership. We also presented this for validation at the National Nutrition Technical Working Group, which is also a forum coordinated by the Federal Ministry of Health and Social Welfare. And eventually, this document was approved by the Office of the Honorable Minister of Health and also subsequently, next slide, launched by the Honorable Minister in September 2022. And since then, we continue to seek avenues to disseminate these documents to make sure that stakeholders are aware that it's available and continue to look at it as a guidance document for looking at, say, maybe definition of nutrition indicators and different components of the document. So for instance, in October 2022, there was a National Nutrition Data and Result Conference where the documents was presented in a well-curated session with over 300 participants attending this workshop. Next. So we also continue to look for avenues through meetings and, you know, maybe, for instance, I'll take an example. In December 2022, there was NDHS planning meetings where they were looking at, you know, what to incorporate into the current now ongoing data collection for the Nigerian Demographic and Health Survey. So we also were present to present the section at that in that recommendation that speaks to NDHS and different platforms, for instance, the inclusion of nutrition in commodity in National Health Logistic Management Information System. Next. So what about this recommendation itself? So the recommendation has 6 overarching recommendations, which really are centered around the whole process of coordinating nutrition indicators, nutrition data in Nigeria, which I'll also speak more to. But we also went ahead to present this recommendation by different indicators type, by different data sources, and we also provided a session that also provide opportunities to describe how to operationalize the document. Next slide. In terms of the overarching recommendation, there are 6 of them, and they are really talking about how do you put together cost consideration, how do you ensure there are resources in terms of both human and financial, how do you put consideration for disaggregation of data, how do you ensure that we develop a set of core indicators with standard definition at all national surveys and administrative data collection points. So these are the type of things that, you know, were presented in the overarching recommendation section. Next. Also, so this is an example of the overarching recommendation. We've listed different surveys that exist. We have the SMART survey, that's the National Nutrition and Health Survey, NNHS. We have mixed survey, we have food consumption survey. And so you see that even though some of these surveys are conducted every 5 years, you also notice that sometimes indicators overlap. So if there is NDHS this year that is currently ongoing, and they collect a data on stunting, and by next year there is a mix that collects data on stunting, it means that every year we are having data on stunting. And meanwhile, stunting in nutrition is supposed to be a chronic measure, which will not even show up until about 3 years. So the question is, do we continue to have this data every year when we don't have data on issues like, say, adolescent nutrition data in Nigeria? So can we move some of the resources for stunting data that is more frequently collected and put them into adolescents? So these are some of the issues addressed by the recommendation. Next slide, please. And so we also have recommendation by indicators. So for the different household surveys, we have recommendations to say, should you add this particular indicator to this survey? So for instance, for the mixed survey, there are recommendations to add adolescent indicators for male and also for school-age children. So these are some of these. So you have, and they are well color-coded to say where you see yellow, you know, you are adding this indicator. So if you need to quickly attend a meeting on a particular household survey, you can pull on this document and say which data needs to be collected that is not already in the questionnaire. Next slide, please. And so also similarly for administrative data. Next slide, please. And so this is also just, it puts different recommendations, and the ones that are strongly recommended is also well described there to say, these are urgent priority. This is something that needs to be acted on immediately. Next slide. And so another thing that the tax team also came up with is, beyond all of this, there were issues that we need to put in consideration for leadership when we talk about data. We need to put in consideration for financing nutrition data collection. We need to consider data quality, and we also need to consider issues of capacity strengthening. And so all across the nutrition data value chain, we need to be sure that all of these considerations are well taken care of. And thank you very much. I would like to stop at this point. Thank you.
Thank you very much, Olufolakemi, for providing us with the background on the development process for the recommendations. I would like to start with Pharmacist Orume, who will help us out with 2 questions. The first is, what types of nutrition data coordination challenges has the health sector in Nigeria faced in the last decade? Secondly, how can implementing the recommendation in the health sector document for nutrition indicators collected nationally in Nigeria help address some of these challenges? Thank you. Over.
Good afternoon, all. Good afternoon. Can I see the first slide? Good afternoon.
Good afternoon, Pharmacist Orume.
Yes, please, can we go ahead with the first slide? The challenges faced, we just want to start with the first one. The nutrition sector in Nigeria does not have common core set of nutrition indicators used across NDA partners. Like every NDA partner, they ride on their own indicators. We need to actually come together to get some core indicators that will run through the whole of the nutrition space. The second challenge is that data comes from many different sources, like Adefolake have told us, and that these data are controlled by different actors. You agree with me that the data are controlled by different actors? We have the survey platform like the DHIS2, MINS, NDHS, and others. We also have the administrative data platform, which include the HMIS, DHIS2, the Health Logistic Management Information System, the Nigerian Governance Forum Scorecard. All these are the administrative platform. Different stakeholders involved in planning and implementing all these surveys and administrative data platform. They run on their own, and there's no point of actually coming together. So it's difficult to influence the content, the timing, and ensure comparability of indicators. That is a big challenge as far as the nutrition space is concerned. Also, we notice that there are bottlenecks in reporting and differences in data sharing policies across the sources, the actors. All this limit accessibility to data. That's a challenge which documents tend to address. Next slide, please. Next slide. Another problem is can we go back? Can we go back? Can we go back? Can we go back? One slide before this. No, one before this. Okay. Nutrition data in the HMIS, DHIS2. The next one now. The next one. Next. The next. Nutrition data in the HMIS and DHIS2 is impacted by system-wide data quality issues. We have data validity issues. There's poor reporting from facilities to the sub-national, that's to the state, and even to the national level. You may want to ask why. Why is there this poor These are things that the landscape analysis have been trying to resolve too. The HMI system structure does not allow for correct denominator for certain indicators, like the sand treatment that we observe over time that the denominator used is not correct, and the HMIs have not made any provision, though they're trying to review the HMIs the tool now. Maybe with that, we could address this particular challenge. Another problem is the coordination and capacity challenges. There is weak multi-sectoral coordination platform. Everybody is running on its own. The coordinating platform is actually very weak. There's need for strengthening. Then we'll not forget to mention the fact that there are limitations in human and financial resources. There's a questionnaire that was given to us at a time. How many nutrition professionals graduate in Nigeria every year? It's difficult to answer. So when we don't know the number of graduates, how do we solve that problem? That's a big challenge. Next slide, please. Next slide. The next question that I'm being asked to answer here is how the implementation of this recommendation can address those challenges. We all agree that the recommendations are very rich and can actually go a long way in addressing the challenges we have just mentioned. The recommendations give key information needed to support a process to identify core indicators, as already presented by the first presenter. There is a process we need to come together, identify core indicators, even as advised or advocated by WAHU. There are about 11 core indicators that should run through the whole of the space, the nutrition space, instead of running on our own. Government and broader nutrition community are equipped to advocate with common voice. This is an important aspect of the document, that we all come together with our indicators and negotiate and advocate on how to make our surveys my supervision processes fully mind. Another way this document can help something we have been talking about. Why Mix has it this year, NDHS has it next year. It shouldn't be so. When we follow this document very well, we'll now know that if something is captured in one survey, the next year survey should not be captured like that. This is a recommendation that all countries should key into, so that we'll not be wasting our resources. Recommendations are evidence of government's strong commitment. These recommendations, the government come together and agree that we should do this. It's a sign of commitment to improve nutrition data coordination, to improve the quality of data, and this can support this document. If we follow it well, it will support domestic and external resource mobilization, because funds can be mobilized from where it's not used wisely to where it is actually needed. It provides opportunity for technical assistance. Countries can come together and relate on areas of comparative advantage and share experience. Next slide. Next slide. Thank you very much. Thank you.
Thank you, Pharmacist Orume, for taking us through the different coordination challenges and how we were able to handle them. Now, I will like to invite Mr. Edward Kutongo to discuss how development partners can align their data to national nutrition data platforms. My first question to him is, how can nutrition data generated by development partners supporting nutrition interventions in health and other sectors be aligned to the government data system in a coordinated way? My second question is, using experience in participating in the NIST tax team, how can partners contribute to strengthening nutrition data coordination in the health sector in Nigeria? Thank you, and over.
Thank you, Data team and our participants online today. I will respond to this, and I'm Edward Tondo from UNICEF, supporting the government of Nigeria on nutrition data. So the first question, and Mrs. Bako, you may share the slides if available. Okay, thank you. So in terms of how development partners can align and support government data systems to ensure coordination, one is to ensure that the partners are supporting government priorities in the specific strategic plans in Nigeria. For example, we have the National Multi-Sectoral Plan of Action on Food and Nutrition. This is a priority document that outlines the results and the indicators, the data sources. So we as development partners, if we work and support the country priority, then we will improve the data system. Second is the development partners investing in national data systems. We have population level data systems like Nigeria Demographic and Health Survey, the UNICEF supported multiple indicator cluster surveys, and the district health information system too for Nigeria that can be, we need to invest there both technically and financially. Third, we need to use common data procedures and processes. This will show you the indicators. For example, I mentioned, if it's the indicator, they will come through this action on food and nutrition and other documents that are there and which are always updated on over time. Tools, if we are using questionnaires, the data collection tools that are there, are we using similar tools? Are questions framed in a similar way? Timing, the frequency and the when of how to collect data. If we come together as development partners and support government, it will work. Lastly but not least, number 4 is development partners need to support the national data coordination system. The government has put in place the Nutrition Technical Forum that meets on quarterly basis and the Nutrition Information Task Team. If partners support the Nutrition Technical Forum, this is where decisions will be made. Decisions will be made on which data to collect, where to collect, and how. So that's what we will use as a decision. The Nutrition Information System Task Team, the NIS, is the technical arm on data for NTF. So this team, if partners come together, we work as technical experts, we will be able to address the technical issues around data, and this will make us to be more coordinated and produce quality data. Next. The second question touches on experiences as a member who participated in the NIS task team and how we as partners can contribute to coordination of data in Nigeria, looking at it multi-sectorally. I want to speak first on the point of procedures and processes that partners have to come together. In Nigeria, we have many players at federal level and at state level. Nigeria is a big country with a population of over 200 million people. So you need these multiple partners, but these partners, for us to be able to support well, we have to use the government recommendations. For example, we have a document that DataDent and partners like UNICEF, World Bank, Alive and Thrive, and the government itself, the different ministries, Ministry of Budget, Ministry of Federal Ministry of Health, Federal Ministry of Agriculture, we came together and looked at this. And this document is now available with the recommendations. We need to then implement the recommendations on the various indicators. UNICEF has also supported the DHIS2 landscape analysis, which has detailed recommendations, for example, on how to support the routine data system. This can also be used by various partners. Then we have the global guidance by UNICEF and WHO on nutrition information system. This is also a document that is very good that can be used. The second point is on coordinating data planning, collection, analysis, sharing, and use across sectors. Since we have what we have in, the determinants of malnutrition cut across sectors. So we are today speaking about health, but we have also other indicators in the food security sector, in the wash sector, social protection, education, among others. So we need to bring this. In Nigeria, the advantage we have Federal Ministry of Budget. This can bring together the different players to coordinate the data collection, the analysis, and the overall use at a very strategic level. The third point is building capacity. We need in-country capacity for data at federal level and at state level. And capacity building is a continuous process, but we need tools, materials that will ensure sustainability. And lastly, on this area of experiences, is just to look at innovative approaches. The world has become more technological. How do we tap into emerging technologies like mobile data, the Smart Plus, and other real-time data approaches to improve how we collect data on time, quality of the data, improve the analysis for accuracy, and just overall ensure that we have good quality data that is also accessible. On terms of access for this innovation, we can use technology to improve how people access data online. So these are the 4 areas I wanted to share with you in terms of experiences. Next. So in terms of these questions, the challenges, the previous speaker has already spoken about the challenges experienced in coordination, like the different players. So I'll speak about this point only in a short way. So it is through the Nutrition Technical Forum that the government has a mandate that brings together all players. The government will know who is doing what, where, how, and bring them on a table for conversation to ensure that we speak in one voice and we implement government priorities. The other point on coordination and use, I want to speak on use. I think we collect data. There is the routine data, the population level survey data. We do evaluations. We have research by development partners, by institutions like universities, NGOs, etc. All this data need to be in forms that can be used easily by policymakers, by other researchers, so that proper decisions are taken and the investment we put in data yields the results, which is better outcome of nutritional status of the population in Nigeria. And lastly, how can we learn from peers and other countries on data? Within the country, using our coordination forum like the Nutrition Information System Task Team, we can come together and share, build each other's skills. We can have online meetings, data clinics that we can share this information. Other countries, for example, UNICEF last year, we organized a Nutrition Smart Manager level training in Nigeria, and we brought in participants from other West African countries like Sierra Leone. This can be a method of also learning and ensuring that we build capacity across countries. So there could be more approaches to do this, but just to say that this some of them. Thank you, Mrs. Bako. Over to you.
Thank you, Edward, for providing more information on how partners have been contributing to strengthening nutrition data coordination in the health sector in Nigeria. Please, for those that are just joining us, kindly feel free to share your questions through the Q&A feature. Please indicate who your question is directed to. Distinguished participants, you will agree with me that the speakers have shared with us the detailed process that led to developing these recommendations and some steps taken to operationalize the recommendations by the Nigerian government and also the relevant stakeholders. I want to call on all development organizations, other implementing institutions, and donor organizations that are contributing to nutrition in Nigeria to align with the nutrition data with the government's priorities and consider investing in ensuring quality nutrition data along the data value chain. At this point, I would like to take some of the questions and comments in the Q&A box. I will read out the questions and any of the panelists will please feel free to respond. We have quite a number of questions that have been posted through the Q&A section. Pharmacist Orume, I think I would like to pose this question to you. And the question says, what will you do to strengthen the administrative data, despite the fact that the current administrative data lack credibility, validity, and integrity? You have 2 minutes, please.
I didn't get you, ma. I didn't get you.
Okay. The question says,
I didn't get the question.
Okay, I'll repeat.
I thought you shared the question.
Okay. It says, what will you do to strengthen the administrative data, despite the fact that the current administrative data lack credibility, validity, and integrity?
Okay, thank you for that question. So I've typed, thank you, ma, for that question. So I've typed in some response. I'll just read it out. To improve on this administrative data, there's need for strong capacity building for those that actually collect this data and report at the grassroots, at the facility level. Need to build their capacity very well. There's also the need for supporting supervision and mentoring to these sites so that we can see the gap. Why are they not reporting well? Why is there this problem? By continuous supportive supervision and mentoring, that can help. Then I also spoke of the need for data demand. If these persons at the facility know that this data will be used for so, and somebody is demanding from up down, they will be more serious about actually reporting this data. So if there are equipment and tools that have not been upgraded or updated, there's need to develop the tools so that this data can be entered at the right time with the right accuracy. That's my response to that, ma, and everyone. Thank you.
Thank you very much, Pharmacist Orume. Now, Edward, there is a question from Daniel Quadrago. I would like you to respond to it. The question goes like this. What is the status of data availability for school-age children? What is the status of data availability for school-age children? Over. Thank you.
Thank you, Mrs. Bako. The area of school age data is a bit limited because of the initial high focus on under 5-year-old children, but in the National Food Consumption and Micronutrient Survey, there's some little data on adolescents, especially 10 to 14-year-olds. So it's an area that we can invest more at population level to have more data in this area. Thank you.
Thank you, Edward, for the response. Now I'm trying to I can't see any other questions on the QA.
Mrs. Bako, there's a question from Patience, from Patience from Obafemi University.
Okay, all right. Yes, thank you. I've seen it. Yeah. Okay. The question from Patience Alabo says, how do we aggregate proliferated data? Is there a national forum where this data can be communicated apart from publishing in journals? Individuals are working in silos. How do we organize ourselves to ensure that informed, gathered, and data generated by individuals from research grants across sectors are coordinated, verified, and made available to inform decisions on interventions? Mr. Edward, can you please respond to this question from Patience? Thank you.
Okay. Thank you for this important question. And thanks also for the various efforts made by different individuals and institutions in collecting and analyzing different types of nutrition data. I'll just make a proposal. One is to coordinate. If you coordinate and understand the priorities of government, that will help to prioritize which data to collect. But once the data is collected, how do you then aggregate? To aggregate the data, you need common variables. You need to standardize the data that you are collecting so that it's easy to merge, it's easy to bring together. So for this to happen, systems must be developed that allow data aggregation, data storage, and data management. I'll give one example that we've just started in UNICEF. Last year, we worked with Action Against Hunger Canada. When we started the Nutrition Smart Survey, Smart Plus innovation, this will help to ensure that all the surveys that are collected, the data that is produced is stored and is able to aggregate, that you will be able to find this data 5 years backwards, 10 years backwards, etc. in an easy way. There's going to be a mechanism of accessing that data, which will have to involve the government of Nigeria. When someone is requesting access, then they will show why they need the data, why they are going to do, and then a small team will then look at that request and grant an access or deny or advise the requester of that data. Thank you.
Thank you very much, Edward, for the response. Distinguished participants, I want to appreciate everyone that has posted questions and also comments. We have quite a lot of comments in the in the chat box. We appreciate all your input. We want to say thank you to the speaker and the two panelists for providing insights into what Nigerian government and stakeholders have done to ensure that we have a coordinated data set and data platform in the country. We want to thank you all for your active participation in today's event. Permit me to quote Kofi Annan, who said, "Without good data, we are flying blind. If you can't see, you can't solve it." You will agree with me that this webinar has been insightful, and we look forward to having another phase to provide you with updates as Nigeria move forward on the recommendation, on the implementation of the recommendations. I would like to now hand over to the Data for Nutrition team to close the webinar. Thank you, and over.
Thank you for joining today's webinar. Thank you to our moderator, Ms. Ladidi Bako Ayugbusi, and our speakers, Alo Falake and Joran, Edward Pintondo, and pharmacist Beatrice Urume. The recording of the webinar will be available in the next hour on the Data for Nutrition YouTube channel, and copies of presentations and summary of the Q&A will be shared on the webinar's group page in the coming weeks. Thank you.